What is the thing which has motivated to you?
Yeah, actually,
How did you execute that process?
I don't have.
What about the FSP exam? You cleared the FSP exam on the first attempt. Tell us more about it.
Yeah, for me, actually,
What are the questions did they ask you?
it's completely about the.
How was your experience? Are people friendly here, welcoming here? How was the staff, doctor, boss?
Yeah, the people, the staff.
Landing this hospitation, was it very difficult or is it doable?
Hospitation,
And what are your suggestions and tips to all the candidates who are preparing, who wants to come to Germany?
my advice to all is.
Hello everyone, this is Dr. Swapnil Chandratre here, and today we have a very special guest, a dentist who has come on a dentist pathway and cleared his FSP exam on a first attempt. And today we are going to extract the information out of him and try to know that how it pathway went, what are the challenges he faced, and how was the exam experience and clinical experience and all that. So please, doctor, introduce yourself.
First of all, thank you for a warm introduction. My name is Binoy, and right now I'm living in Germany. I completed my bachelor's in 2015, and I had a practice, 2 dental clinics in Kochi, around 6 years, and right now I'm in Germany.
Tell us that why, you had your own clinic, which is a very successful running clinics, 2 clinics, and then you decided to move to Germany. What is the thing which has motivated to you?
Yeah, actually, I always wanted to do a post graduation or something like that. So I was practicing for 6 years, and that time Corona hits, so we don't have much patients in clinic. So I just wanted to do something different, like not normal people do PG in India. So I don't want to do that again. 3 years of investment and again clinical struggles. So I decided to do something different. That's how I came to know your videos in YouTube. I watched all your videos, and then I decided, yeah, Germany would be a best part for me. Then I started researching for around 6 months. Initially, I started learning Germany, and then I dropped it after 6 months. Again, I restarted it. So finally, I completed my FSP exam. Yeah.
So how did you execute that process? How it went from learning language to documentation? How did it go?
Actually, I don't have much struggles. You did it for me. Everything was like I used to ask you questions. I had a lot of questions for you because I had 2 clinics at that time, so I don't have enough time to do all this research and paperwork. That's why I just talked to you, and you did it for me, the paperwork. But still, it's like a time-taking process. I know all the process how to come to Germany. Right now, I can tell you everything. But still, I think it's like a complicated pathway. Initially, we have to be patient. Yeah, what to say, everything you did for.
And how did it go? You learn till B1 in India, and then you learn.
Yeah, so initially I started by language, A1, A2. Yeah, till B1 I did it from India itself. I completed till B1 around 1 year. And after that, I came to Germany, and B2 and FSP I learned from Germany itself. Learning German was a difficult struggle for me. Initial times it was very difficult because I had 2 clinics. Between I have to learn the language also.
What about the FSP exam? You cleared the FSP exam on the first attempt. Tell us more about it. That how much time did it take you to land an appointment? What happened in an exam? Very descriptively, you can tell us all your experience.
Yeah, for me, actually, the appointment part, every friends who had waiting for an appointment telling me like all the time they're not getting any termin. But for me, it's like I got a termin in 3 months, like for FSP termin. So it was not a difficult part for me. So they were calling me in between, do you want an early appointment also? So I told, no, I just want to be in the exact time. It was in November. So for FSP termin, I didn't face any difficulty. Like most of the people, my friends who came along with me is also struggling to get an appointment. So for me, it's not like I got an appointment. Luckily, I got an appointment early. And I just started preparing for around 3 months. I did a hospitation, but it was only for 1 month. After that, because I got a date within 3 months, so I just wanted to focus for exams. I studied for 3 months intensively. The November 11th was my exam date, and I got cleared. And for exam experience, I would like to tell you a little bit more because the exam part was not that easy for me. One of my friends, he got an appointment last week. For him, the exam was a bit easy and the commission was also good. For me, it's like first and second trial was good. Yeah, I did an amnesic experiment with the patient, and the second trial also was good. But the third part, it's like kind of a little bit of difficult. They asked me a lot of questions. It's all about the patient first part. What did the patient said? What symptoms did the patient said and all. and the patient was wearing a mask, and it was very difficult for me to what the patient exactly saying, because it's like a 10-meter distance between the patient and me. So it was like little bit of difficult, but thankfully I got exam.
What are the questions did they ask you? Were there too much of the knowledge related? Is it? So what was more it is about? Is it more about, that very much difficulty in anatomy and all those kind of difficult questions, or what are the questions they were asked?
It's completely about the language, how we are communicating with the patient, and how we are showing interest towards the patient questions. And it's all about communication, I would say. How well we are handling the patient, how well we are behaving with the patient, how cool we are in the exam, and like that. Obviously, we have the anxiety, but still they're checking all our communication. I didn't get any question regarding the theory. I did learn a lot of theory part, but no questions I get from the theory part. Yeah. The examiner was asking me the symptoms which patient said initial first time. So what was the patient speaking about? What symptom was the patient having? When did the pain got elevated and like that?
Okay, so it was like in first style is anyway the anamnesis, so that is a history taking, and based on that, whatever you have written the report in the second part. Okay, in the third part, they just asked you that thing and repeat. So no other questions like what do you do for extraction and what do you do for install. Okay,
I thought I got a patient with sinusitis, and I thought they will ask me the root canal procedure, which I'm good at, but they didn't ask anything.
Okay, so nothing about the dentistry more, just more about the language. Yeah,
Language part and the symptoms and the patient, the what the patient said, the E-shift style.
see.
Yeah, exactly. How did you came to the diagnosis? What was patient said? Which symptoms was the patient having, like that?
Okay, and how many examiners were there?
I think 5 or 5.
Okay, and out of them, one was a patient.
Yeah, one was the patient, and the 2 others were asking me the question. Yeah.
Okay. And do they tell you the result immediately, or do they send it after some days, or would that happen?
Actually, there are other candidates also. So for me, I'm the last candidate. So after my exam, they took around 20-25 minutes. That was like, I don't know why, but they took 25 minutes, and I thought I were failed. So I was asking the other people like why they are taking a lot of time, but I don't know. But in 20 minutes, they gave me the result. Yeah, finally.
Okay, they called you in and they tell you on your face that you have passed.
Yeah, they called me again, and they just asked me to sit, and they just told me that you are best standard and you did well in the first tile and second tile. Yeah. And what's your future plan? Everything they asked, like in a friendly manner.
Good. So in the end, they talk to you with the friendly manner, no? So that is important.
Yeah. In beginning also, they didn't talk to me in rude manner, but I got my anxiety at peak, so like I couldn't talk to them much. That's it. They were good, but they didn't so friendly. Like they were like helping me out. That's
Yeah, it is generally like that. In exam atmosphere, we are more stressed than they are. And, sometimes we do that kind of mistake, but that's good that you hold your nerve and you
Yep.
clear. So you also mentioned that you done 1 month of your hospitation. Can you tell us about your experience? See, you have your own clinic in India. You have worked everything. You have done everything. Okay. So after coming to Germany, working or seeing how the dentists work in Germany, what kind of difficulty do you think you will face later on, and what are the things you have to learn a lot, or what is the difference did you find?
Yeah, actually, I did a hospitation for 1 month approximately. So initially, it was a little bit of difficult. The materials they are using is a little bit of different than India, and the way of their practice, they are like more insurance oriented. So the treatment plan, so we have to learn it. But I didn't get the much of an opportunity to learn because I nearly did for around in a week. I did hospitation for 3-4 days, and it's only around 4 weeks. So I couldn't tell exactly what challenges we will face, but it's a different system than India. We used to more about the treatment plan. We'll start treatment the day itself, but here they have to follow certain criteria, and we have to fill some forms, and we'll ask the patient to come in next appointment. Yeah, it's like that. And we have to learn the instrument names. It's a lot of difference is there, but basically the things are same, but it's like completely into a new system. Like they have a modern devices and all. In my clinic, there is a OPG, a machine, and CBCT. Everything is there. the patient no need to go for anything. Yeah, so it's like hard to learn in 1 month. It will take some time.
That's a definite thing that, it took me around also 6 months time till I learn everything for this insurance and these positions we need to give on the computer and all that thing. Because here, 50% is working and 50% is documentation, right? So that portion we learned during our assistant dentist side, that is normal. How was your experience? Are people friendly here, welcoming here? How was the staff, doctor, boss?
Yeah, the staff are very friendly. And I had an experience of 6 years also. Then I was discussing with my cases to them, and they are also like appreciating me. Oh, you did that in India. Okay, that's good. We can like do it here also. Let you complete your exam. We will do it together. Like that. They were like so friendly. They will bring us to like after eating, we'll all together will sit in a place and we'll have a coffee session and all, like a home experience only. They all are like a family, and they are like good to us. They don't treat us like a foreigners. That's really appreciable.
Landing this hospitation, was it very difficult or is it doable?
Hospitation, like, I searched for some clinics to get an hospitation, and my house landlord, she knows some dentist personally. So for that, she's a like a local lady, so she has good contacts for hospitation part. I didn't have to search a lot, so I got an hospitation easily. So yeah, it's like we'll get it because we can go talk to the chef dentist, and if they are interested, we'll get the hospitation part.
Okay. And regarding this FSP preparation, you did the classes also. Okay. How was the level of that classes, and did that hospitation help you also in the way to prepare for FSP and all that thing?
To be frank, hospitation much because I didn't have much time to do the hospitation. After the class, I got an exam in 1 month, so I didn't have the time to go to hospitation again. So during the class period, I was like on to the daily, it's 5 hours classes, FSP class, and it's very good. I did it under their classes are very good. Initially, you told me like I asked you for a 6 months class, but later I came to know that the 3 months is enough. It's an intensive class. We have to give our 100%. They will like a little bit of pass, but I think that's enough. And their classes are also good. After FSP classes, I had around 1.5 months for exams. So I didn't go for hospitation because I want my full time to give for my studies. So my hospitation was around 1 hour distance from my home. So I don't want to travel because it will take some time. So I didn't get much time to studies. So I focused on FSP exam completely. Hospitation is when you'll get, it's like more language exposure.
Okay.
And how do you do hospitation? You can talk to the patient, you can talk to the chef. So that will definitely help in the exam.
Yeah. And what are your suggestions and tips to all the candidates who are preparing and who wants to come to Germany? And there are a lot of rumors out there. You have also faced like that. That exams are very difficult to pass. They have quota and they pass only this much amount of people, and it's very difficult to do it. And you yourself have passed through with this process. Okay, so what do you tell about that thing? Is it that what the people are spreading the rumors about, or what is your suggestion to everyone?
So my advice to all is you have to be focused. You have to focus on what you are doing. First, you have to keep a plan. If you ask 100 people, like 100 opinions will come. So it will only make you tense. So what I think is like you have to be focused. Yeah, you have to ask people. That's it. That's okay. But to focus on what you have to achieve. Like first you have to pass FSP exam. You have to focus on FSC only. Yeah, like no need to ask 100 of people. So it's like a complicated, long process. Not complicated. It's like a little bit of long process. It will test your patience, but I think that it's doable. Everyone can do it. Like we have to be focused on it. First, we have to set a goal that I will complete my FSP exam in certain time. So you have to prepare on it. And one more thing I would like to advise everyone is like it's better if you people like every day if you can, like before 1 month of exam you can do a simulation with other people. It will be better. That improves your confidence. In this 20 minutes you have to complete all these questions, so it's a challenging part. You have to talk, you have to practice it like around 10:30 simulation. That will be good. So you have to be patient and focus on your goal. That's my advice.
Good. Then thank you very much, Dr. Binoy, for your time. And first of all, congratulations and best of luck for your future journey. We'll stay in touch. And I hope that everyone has also found some idea and motivation after Binoy's journey. And if you have more questions and how to execute this thing, you can always contact me. The link is in the description box. Till then, have a nice day.